And even adults, not many of them will have that discipline. So you find that even some adults will come, wear it. Halfway through the treatment, things are just not fitting. But somebody comes and tells you, no, I've been wearing all the time. Basically, Invisalign, it's a much newer way of aligning teeth without using the brackets on the teeth and the railway track you put on the teeth, whereby it's computer generated, where you have the computer is like taking many scans of the teeth, starting from the initial position, and then the computer aligns those teeth slowly, moves them slowly, and at each stage of the alignment, you create an aligner or a clear tray for the teeth, so that you have these many trays that somebody wears from tray number 1. It moves the teeth just a little. Then after about 7 to 10 days, you go to the second set of tray. Again, you put that. So you may probably go, sometimes you find anywhere between 25 and 40 sets of trays. And it takes anywhere 1.5 to 2 years or something like that, even 3 years to align the teeth. Aligners is good, especially for adults and people in the corporate, people who are in meetings and their image matters a lot and they don't want to have these brackets because they are talking in front of people or public, something like that. It's quite good because you can actually remove that aligner, go for that board meeting, and then come back and wear it. Because ideally you should wear that aligner. Different systems have different formulations, but they range from somewhere 17 hours to 22 hours per day. You need to have the aligner in the mouth. And therefore, people who are in that kind of environment, we are still able to straighten their teeth using aligners. Invisalign for children, that's what you asked. You have all these many sets of trays that you need to wear, and you need to be very consistent. And it takes a lot of time for people to wear them, to remove them, to take a drink, to take food, to go brush their teeth. They need to remove them, and that kind of thing. So when you give these aligners to children, the children are not able to handle them because of compliance, because you're asking too much from a child. Asking them to carry this set of aligner to school, remove it over break time, take a snack, go back, wear it, take another snack somewhere before lunch, remove, wear, lunch hour, remove, wear, 3 o'clock. No, they can't handle that. What will actually happen is that even if they really wanted it or the parents really wanted it, they may do it aligner number 1. But by the time they get to aligner number 3, they come home, they've lost it.
All the progress.
They've lost it. And now, aligner number 3, the next aligner cannot fit in the mouth because you needed to use this aligner for this number of days to move this teeth up to this point before you put the other one. So you try to put the aligner behind, can't go in. Aligner hand, can't go in. So what do you do with the rest of the sets? A whole 30-something sets. That's done. You have to go back to scratch.
Square one.
Square one and start with the aligners. And the cost, it's too costly. And it's not really worth it. Yeah.
So for straightening, for children, you would advise braces?
Yeah, for children, you basically go for traditional braces. I think that's the thing to go. Yeah, because that way they will eat whatever they need to do. It's not, they are not participating too much in the treatment. It is the doctor who is actually doing almost everything. But for Invisalign, it is actually the patient who is actually doing their own treatment. So you're asking a child to be in charge of their own treatment. It just is not practical, and I think it's demanding too much for the child. Even teenagers, it usually doesn't work well. From young adults, young adults from around age 20 and above, those ones are able to handle it, but not all of them. Yes, so this is actually more for treatment, more for adults. And even adults, not many of them will have that discipline. So you find that even some adults will come, wear it. Halfway through the treatment, things are just not fitting. Why? But somebody comes and tells you, no, I've been wearing all the time. But this one can't fit, this can't fit. And for sure you know, they either went for a whole night or 2 days without wearing, and that's why nothing is. And you still have to repeat everything. Or switch to braces.
Yeah.
Yeah.
What I'm hearing is Invisalign was a method created for adults. Like you've mentioned the corporate.
Yes.
I think that was maybe the target market.
That was the target market.
Yeah. Because it's you can consider it stylish in a way whereby no one is seeing, it's inconspicuous.
Yes.
Yeah. So yeah, I think many people will appreciate that information. A lot of parents want to fix their kids' teeth and they hear about Invisalign on the internet and they're wondering, okay, now how do I integrate this?
Yeah, and it's more expensive. It takes much longer time to do, but there is those are particular patients who definitely will benefit from Invisalign because that's of their career and that kind of thing, their occupation. So that kind of patient will. But somebody who wants to do a quick aligning of their teeth, then the traditional braces. Yeah.